Good evening, everyone.
Good evening, sir.
So, I think we should first take the practical experience from the people who are already seeing the patients. So, let us start from Shahista. How is your feedback?
It's going good, but I just feel that the client is he was a bit off from physical activity, but I can see a great improvement in his physical activity.
Okay. So,
Also,
uh-huh.
initially he was feeling a bit of like hunger. The hunger level was on the greater side, but as the time is passing on, he doesn't feel like eating more. He's
Okay.
getting adjusted to the diet. He
Okay.
feels good and normal.
So, how is the difference between your normal client and this client? What difference could you feel?
Normal clients, basically we usually focus on like all the like here we are in these clients we are focusing on protein.
Okay.
Okay, we are seeing to that with smaller
So,
amount of,
I'll make easy. This client is easy or your clients are easy?
they are these clients are easy.
This client is easy.
Yeah.
He has already done his dieting with a lot of dietitians.
Yes, yeah, he told me
After
that.
that, he has taken this balloon thing. So how much weight he has lost till now?
Initially it was started with 155 or something. I think 6, 7, 4, 5 kgs he has lost for now.
No, you are not updating with him. He has lost 8 kgs. Just remember,
Sorry.
every 100 grams for him is important.
Yeah, yeah.
So whenever he sends his weight history, see it carefully. Otherwise,
Okay.
he will get annoyed.
Okay.
Understood my point? This is very important for any weight loss person. Even if they have lost 100 grams, you have to mention. That is a big boost for them.
Okay.
So I check 100 patients' weight history, in the morning.
Okay.
So very careful when you somebody is sending weight, ask him to send body composition analysis daily. This is very easy to send.
Okay.
If he cannot, he can talk to Noor and see how he can send the body composition analysis. Okay.
Okay.
And Bhumika is there. How is your experience with the patients?
Yes, so it is good. Like she's not very much into physical activity and everything, and also she has a lot of myths related to diet,
Mm-hmm.
which I am trying to clear it out, and some of them are already being cleared.
So,
For example, like she was in a fear to take protein.
mm-hmm.
Like she believed that by taking protein, her weight gets increased, but I cleared that it is not
Mm-hmm.
like that, and also like her recovery will be better if she takes protein, and she was taking fluids also in a very like बहुत बहुत डर डर रहे थे वो कुछ भी खाने से
So
पहले.
this patient is tough or your other patients were tough?
A little tough but manageable.
So these people, they know how to dodge.
Yeah,
They
yes,
have already
I
learned how to
realized that.
dodge.
Yeah, I realized that, but now she is doing
So
well.
you have to be more smart than them.
Yeah, yeah,
And
now she's doing well, she
I
is following
suggest,
up.
I suggest all of you that you always post some motivational things for them. And even if they lose 100 grams, 200 grams, appreciate it on the group. Tell them you have done an excellent job. It gives them a push to follow your advice more. So Uzma is there. Uzma has joined. Uzma has not joined. And Daksha is there.
Yes, hi, good evening, doctor.
So what is your experience with your Australian patient?
Oh, it's been very good. She's a very nice lady.
I think your voice is little bit less. You can increase.
Wait, let me just increase it. Yeah, the experience has been very good. She's very nice. She connects with me almost every day. And now consultations have reduced definitely, but pehle we were even connecting twice, thrice a day.
Okay.
Yeah, and she's keeping well. I think उनके stitches भी अब हट चुके हैं, right?
Yes, it has been done today. So how
And
much weight she has lost?
I am not sure. Reason being, she didn't connect with me today. She was out for shopping.
Okay, okay.
She
No
said we'll
problem.
connect later.
So she's enjoying within 4 to 5 days of surgery. She's doing shopping.
Yes, she's actually out going shopping in such a high temperature. It's 42 degrees.
Yes. Okay, so I
Definitely
think
better. She was asking me if it was a good idea to, get the surgery done. Then I counseled her very well. So she's happy. She's definitely happy.
okay, I think we can start from your presentations first. So who wants to go first? बोला वृंदा या फिर और दक्षा, who wants to start first?
I can start, not a problem.
Okay, so I think you have to be a little bit louder, so you
Okay,
can start now. Whenever you want, we can go to the next slide.
all right. Okay, so basically, hello, hi, good evening, everyone. I will be giving a few insight into how to break the weight loss plateau so that even in the cases like this surgery, उसके बाद में there tends to be a saturation. Weight stops dropping. So I'll tell you why it happens and how we can overcome it. We can start, yeah. So basically, why exactly it happens is that your body, it sort of, see, if you're restricting your calories and your body weight stops dropping, तो उसका simple सा reason is that your body is putting you into energy saving mode. आपकी बॉडी को समझ आ रहा है that intake नहीं है, you're not eating enough, so your body needs to preserve its nutrients so that बहुत ज़्यादा losses ना हो. In case of emergency, body should have some reserves. So that is exactly why your body adapt to low energy levels because you're depriving your body of the food. So restricting your calorie intake to less than 900 is also not a very good idea. अगर उनके मेटाबॉलिज्म को स्लो डाउन होने से रोकना है तो वी नीड टू टेक एटलीस्ट 11-1200 किलो कैलोरीज पर डे. Right? Yeah. So exact causes and reasons are that क्यों नहीं weight loss हो रहा is that number one reason is that you have cut yourself some slack. आपने जब डाइट प्लान फॉलो करना स्टार्ट किया था तब आप सब चीज़ एकदम डिलीजेंटली फॉलो कर रहे थे, बट देन नाउ यू हैव गिवन योरसेल्फ सम लिबर्टी. You fail to realize that even the snacks that you're consuming वो भी calorie input दे रहे हैं, right? Next reason is that you do not have enough muscle to sustain, क्योंकि muscle से metabolism boost up होता है. Basically, your body needs to put in more efforts to burn your protein than it does to carbohydrates. तो अगर आपकी बॉडी में enough muscle नहीं है तो भी एनर्जी कम यूटिलाइज होती है into your bodily functions. So again, third reason is that your metabolism has slowed down. उसके भी काफ़ी reasons हो सकते हैं. One is that you're not eating enough. आप ज़्यादा प्रोटीन बेस्ड डाइट नहीं ले रहे. You're not drinking enough water. Because water in the sense वो thermogenic effect of food होता है. जब भी आप पानी कंज्यूम करोगे your body raises its metabolism. क्योंकि बॉडी को उस टेम्परेचर पे लाना होता है पानी को. So that is one reason why your metabolism has slowed down. Another reason why you're not reducing weight is that you are aiming unrealistic goals. अपने BMI को बेसिकली अपने BMI और अपने करंट वेट के अकॉर्डिंग एक रियलिस्टिक गोल सेट होना चाहिए जो सस्टेनेबल हो. यू शुड नॉट बी टारगेटिंग मोर देन 4.5 kgs पर मंथ. आइडली 3 किलो भी अगर एक महीने में हो रहा है फॉर पर्सन हु इज लेट्स से समवेयर अराउंड 28-29 BMI, तो वो काफ़ी रियलिस्टिक गोल होगा. Then next major reason is that you fail to objectify your achievements. आपकी बॉडी में रिस्पॉन्स आ रहा है, योर बॉडी इज इम्प्रूविंग, अदर पैरामीटर्स आर इम्प्रूविंग बट योर स्केल इज नॉट शोइंग वेट रिडक्शन. तो अगर आपकी बेली फैट रिड्यूस हो रहा है तो एनी वे एब्डोमिनल ओबेसिटी कम हो गई विच इज़ अनदर अचीवमेंट. अगर आपकी बॉडी में एनर्जी लेवल्स बेटर फील हो रहे हैं देन दैट इज़ अनदर अचीवमेंट. अगर आपकी स्लीप इम्प्रूव हुई है दैट इज़ अनदर अचीवमेंट. तो वेट लॉस एक सिर्फ पैरामीटर नहीं होना चाहिए. दैट इज़ व्हाट आई मीन. Next reason is that you're stressing too much. If you have high stress, your cortisol is going to be higher. Cortisol ज़्यादा होगा, इंसुलिन ज़्यादा रिलीज होगा, इंसुलिन का रेजिस्टेंस बनेगा, एब्डोमिनल ओबेसिटी होगी. तो इट इज़ ऑल कनेक्टेड. अनदर मेजर रीज़न इज़ यू हैव पुअर न्यूट्रिएंट एब्जॉर्प्शन. अगर आपकी गट हेल्थ ठीक नहीं है तो कुछ भी खा लो, अगर वो एब्जॉर्ब नहीं हो रहा तो उसके न्यूट्रिएंट्स नहीं जाएंगे एंड यू विल एंड अप नॉट रिड्यूसिंग द वेट. So what can be done to actually break this plateau is that you track what you're actually eating in accurate portions, maintain a food diary, maintain a track of what all you had. बीच में अगर एक कटोरी नमकीन खा ली उसको ट्रैक नहीं किया तो इट इज़ गोइंग टू increase your calorie intake. Next up we have is add protein because again it requires more energy to burn protein than it does to burn carbohydrate. तो अगर आप similar calories का protein ले रहे हो तो आपकी body metabolism boost up करेगी and you end up reducing it. Then increase hydration. Cold water अगर आप ले रहे हो your body will have to work to bring it to the body temperature. तो जिस भी फॉर्म में अगर आपकी बॉडी को काम करना पड़ रहा है इट इज़ डेफिनेटली गोइंग टू इंक्रीज योर मेटाबॉलिज्म. तो एवरीथिंग कम्स डाउन टू इंक्रीजिंग मेटाबॉलिज्म. अगर वेट लॉस नहीं हो रहा उसका रीज़न यही है. डिस्पाइट हैविंग लेस क्वांटिटीज ऑफ फूड, if you're unable to reduce weight, chances are that your metabolism has slowed down. It could be even be because of any comorbidity. Thyroid में बहुत slow down हो जाता है. So you keep your blood parameters in check. Then you cycle your workouts. अगर अभी बहुत ज़्यादा कार्डियो कर रहे हो यू स्टार्ट लिफ्टिंग. अगर लिफ्ट कर रहे हो यू स्टार्ट लेट्स से कार्डियो इंक्रीज कर लो, योगा ऐड कर लो. इट्स गुड फॉर योर मेंटल हेल्थ ऑल्सो. you'll have to cycle the workouts. Basically this is what I mean because stagnation आ जाती है. अगर सेम वेट्स उठा रहे हो तो भी you're going to see stagnation. So takeaway basically is that trick is to eat in a mindful way. सबसे पहले तो distractions हटाई जाए. We are so used to being around screen. हमें खाना खाते हुए टीवी देखना होता है. We want Netflix, we want some other distraction. But this is actually not the right practice. We have to avoid the distractions. We need to smaller down the capacity of our cutlery. छोटी प्लेट और छोटी कटोरी यूज करोगे so you will be mindful about how much portion you are taking. Right? Then you'll have to plan meals ahead of time. Previous day पता रहेगा next day क्या खाना है तो you'll definitely incorporate nutritious food. Usually what happens is आपको समझ नहीं आ रहा है इवनिंग में क्या स्नैक लिया जाए. You end up eating just about anything. That is not the right practice again. So if you're planning that you need to be consuming sprouts the other day, you'll have to pre-plan. You'll have to soak it, sprout it, so it will give you good impact. Next is you can fixate the meal timings because then your pancreas will know when to release your insulin, when to release your bodily hormones. तो हर रोज कोशिश करो 30 minutes की fluctuations is still normal, but of course we need to fixate our meal timings. Lunch 1 बजे है तो 1 बजे ही होना चाहिए. Next, occasionally you can do a detox. Your body will function in 100% capacity. अगर आपने एक दिन कुछ detox किया, no grain fasting किया, you're just going to be okay. Body के reserves deplete नहीं होंगे. We can definitely go for a juice feasting या आपने no grain fasting कर ली for one entire day. Then another is skip a meal or two if your gut needs it. अगर आपकी if you feel that there is indigestion in your body, you can absolutely skip a meal. कोई problem नहीं है. Then again learn when to stop. Listen to your body, listen to your gut. Stop when you're 80% full. बहुत ज़्यादा आपको stuff up करने की ज़रूरत नहीं है. You can simply eat till 80% capacity. You can take help of water to provide you a little more satiety. That is what I had to add. If you have any doubts, I'll be open to answer.
Okay, I think it was very nice. We will do the question answer session in the end.
Okay. All right.
Vrinda, are you ready?
Yes, sir.
Okay, go ahead. You have
Yeah,
done an excellent job. We should clap for her first.
Thank you.
Yes, go ahead.
Okay. So good evening, everyone. Today I'm going to speak on vegan diet. So let's begin with what is vegan diet. So vegan diet is a diet that does not include any food items that are sourced from animals, be it milk, eggs, cheese, honey, etc. People on this diet consume only plant-based food. Plant-based diets are helpful in many ways. It is said that it considerably lowers the risk of atherosclerosis, that is clogging of arteries due to fat deposits. Soybean, almonds, beans, quinoa can be consumed in order to fulfill the demands of proteins because plant proteins are said to be incomplete proteins unlike the animal proteins. Fortified foods are good substitute for calcium food. Also, almonds, broccoli, tofu, soy milk are also excellent calcium sources of plant-based food, because calcium is mainly found in dairy products which cannot be consumed in a vegan diet. Also, flax seeds, vegetable oils, and other plant-based supplements can be consumed for omega-3 fatty acids, as omega-3 fatty acids are mainly found in fish. So next is the constitutes of vegan diet. Vegan diet includes fruits, vegetables, legumes like lentils, peas, beans, and grain items like bread, roti, etc. A vegan can also consume soy, coconut, almond, and cashew milk as dairy alternative. So next is, how does a balanced vegan diet look like? When a person is vegan, he can consume high-fat whole foods like nuts and seeds, avocados, etc., and legumes like peas, beans, lentils, seeds, so as to have daily protein intake, and also green leafy vegetables like broccoli, cabbage, spinach, kale, from which he can have all the needed vitamins, minerals, and whole grains like brown rice, buckwheat, barley, and other whole grain breads, pastas, etc., and all kinds of fruits and vegetables. So, advantages. Vegan diet is a diet that is low in fats, saturated fats, and cholesterol, because naturally plant foods are said to be actually cholesterol free. And also, the chances of contracting chronic diseases are also less, as people who do not eat meat have less chances of gaining weight and becoming obese. Also, people following vegan diet are less likely to develop type 2 diabetes and various kinds of cancer. This is because vegan diet is supposed to be low in saturated fat, high in fiber, fruits, vegetables, and other substances like phytochemicals and antioxidants, which are found only in plant-based products, that is, various kinds of vegetables and fruits. Vegans also have a lower body mass index than people on animal-based diets. Disadvantages. So, shifting to a vegan diet and cutting down animal products involves some risk, like the deficiency of several minerals, protein, calcium, omega-3 fatty acids, zinc, vitamin B12, and vitamin D, because all these are mainly products in animal and animal-based products. And also, protein is very crucial for a lot of important metabolic reactions, as they are called as the building blocks of human body. And as I said, protein content for plant-based foods is very less than animal products. And also, since plant-based protein do not contain all the 11 essential amino acids, they are said to be incomplete source of proteins. And vitamin B12 nutrient can be found only in animal food products. And it is the very essential vitamin that is required for making red blood cells and DNA. So a vegan person can maintain a vitamin supplement and fortified food products that will make up for the nutrient needs. So these are the health risk of a vegan diet. So if a person follows a vegan diet without a proper knowledge and without proper supplementation, then he or she might suffer from hair loss, dermatitis, anemia, that is low hemoglobin levels, osteoporosis, that is because of calcium deficiency in the body, and also depression, anxiety, hypothyroidism, and sarcopenia. Next is supplementation in vegan diet. Even though vegans are able to maintain a healthy weight, it is equally important to balance the food they eat with proper physical activity if they wish to lose further weight. And as discussed, since the plant proteins are incomplete source of proteins, people following this diet may also need calcium supplements or fortified cereals or vegan milk, which are mainly found in dairy, since they are only found in dairy products. For complete proteins, the vegan should always consume two types of food. For example, they should eat nuts and seeds combined with other foods in order to gain sufficient amount of plant protein, or like whole grains food with lentils, or whole grain food with some sort of nuts and seeds. It's possible to get complete proteins even from just plant-based food, but this can be obtained only when he or she combines two types of food products. Also, vitamin D and B12 supplementation is necessary. Thank you.
I think you did an excellent job. We should clap for her, and we come to the final presentation. Very good. So I think आपने बहुत सारे take home messages you have given, and we will discuss in the end. So we'll finally go on
Thank you, sir.
this today's topic, which is very important. People who are managing bariatric surgery patients, how to treat the common dietary problems or any danger signs which they have to keep in mind while treating these patients, because they are different from the patients who are basically taking diet from you to lose weight and who have not undergone surgery. So I think we already know about all these phases. Just a revision. There are 4 phases for this: clear liquid diet, which is started after 24 hours, may last for 1 or 2 days. Full liquid diet, which starts from at 3 days or fourth day, goes up to 1 month. Semi-solid or pureed diet after 1 month, and low-fat solid diet after 2 months. I think this is a sample diet chart. Those who are already seeing the patients, they know that homemade protein is very important. If initially patient cannot take because of thick consistency, start with the whey protein, and once after 2 weeks is over, go for homemade protein shake. And this, I think all of us the video. Share this video with your patients so that they know how to make it. I drink it every day. I like it very much. If the patient is not able to digest banana, remove banana. Rest is fine. This is a very good protein source. It gives 20 grams of protein in a one shake. If you give chana powder from 30 grams to 50 grams, the total protein content becomes approximately 30 grams, which is more than a scoop of whey protein, which is only 25 grams. This is a sample diet for phase 3. Homemade protein shake is necessary during that diet. So two things are very important for a person to continuously lose weight, as explained in the first presentation by Daksha, is high protein content and an activity. If these two things are there, patient will always lose weight and will never regain weight once they have lost. For phase 4, remember 32 T's, chew diet 32 times, eat slowly so they won't have any issues. Don't drink water 30 minutes before and after the meal. So danger signs are very important when you are seeing a bariatric surgery patient. So I'll discuss the danger signs. First danger sign is fever. Suppose a patient who is post-op day 2 or day 3 or day 4, you talk to them and they feel, I am not able to get up, I am having fever. The first thing is ask them to measure the temperature. Sometimes 99 also they think it is fever. If the temperature is more than 100, then it is fever. It is important for us that we should find out the cause of fever. They can be multiple causes. Most of the common cause on post-op day 2 or day 3 is chest infection. If a patient is not doing spirometry, as we have explained them before surgery, I give them a spirometry for free. Next, during the next presentation, like exercises after bariatric surgery, I will tell you in detail how spirometry is done and how we should do it after the surgery and before the surgery as well. So spirometry is very important. If the patient is not doing spirometry, they can have chest infection and fever. So you have to alert the surgeon immediately if a patient says the patient has fever, because then we have to talk to them and find out what is the cause. Second cause, because we use a urine catheter, is the urinary tract infection or burning micturition. So you have to ask them if they are having any cough. If there any cough is there, the sputum is coming out, that means the cause is chest. Second is if there is a burning micturition, then the cause can be urinary tract. And third important cause is a leakage in the stomach, which can be life threatening and can endanger life. So if a patient has fever and also has abdominal pain, ask them to contact us immediately, because early intervention can save patient's life, and you all will encounter once in a lifetime where your alertness can save somebody's life. So this is the danger sign during dietary phase. Whenever patient says fever, try to find out how much is the temperature. If it is more than 100, it is a danger sign. If what are the things they are having, they are having cough, they are having abdominal pain, or they are having burning micturition. If they are having abdominal pain, it is very serious. Ask them to contact us immediately. Second important sign is a tachycardia. Tachycardia means increased pulse rate. Both increased pulse rate and decreased pulse rate are important, but in bariatric surgery patients post surgery, if the pulse rate is more than 100, which is known as tachycardia, is very important. Ask them to contact us immediately if the pulse is more than 100. Some of the times when a patient is taking a BP medicine and it is a beta blocker which decreases the pulse rate, After the procedure, if the BP is normal and if they are not taking medicine, the pulse can increase. But it can be also a sign of bleeding inside the abdomen. So if a patient is having tachycardia or increased pulse rate, also having fever, having abdominal pain, it is very, very serious. Ask them to contact us immediately, because immediate intervention can save patient's life. So this is the second most important danger sign, is tachycardia. Third important danger sign is abdominal pain. See, we are using staplers. We use the best quality staplers. We also do suturing. If anybody is interested, they can come to the operation theater and can see the surgery. We have a surgery day after tomorrow. So if there is a leakage from the staple line, the patient will have fever, increase in pulse rate, and as well as abdominal pain or a left shoulder pain. If the patient has this, is very serious, inform the surgeon immediately. Ask the patient to report to the surgeon immediately, because all this can be handled if the complication is known. If it is not done, not treated properly in 24 hours or 48 hours, it can become very serious and also can become life threatening. Second is a bleeding. If there is a bleeding, again there will be abdominal pain, there will be increase in pulse rate and also sometimes fever. And because there is a staple line, any some of the patients are taking blood thinners before surgery, so they can have chances of bleeding. Some surgeons give blood thinning injections for 4 weeks also, that is the time where bleeding can happen. I don't give any blood thinning injections. I ask them to walk and give them stockings. So there is a difference. So these three are the most important danger signs. Whenever you are seeing a patient, if you find any of these, ask them to contact the surgeon immediately, and also inform the surgeon immediately that this is happening. So the first thing you will notice with them, that after the surgery, some of them will say that there is some nausea or a feeling of vomiting, or vomiting is there. And the most common cause is eating or drinking too fast. If they are drinking too fast, the stomach is small pouch, it fills and then it causes nausea. Or they are drinking too much. Start, they're a newborn baby, like a newborn, start from 50 ml per hour only. And if they are comfortable, then increase to 100 to 150 ml per hour. But if they feel full, it is not necessary to feed them every hour. You can wait for 2 hours or 3 hours, no problem. But don't force. And when they are on the phase 4 diet, if they are not chewing properly, that is 32 times they have to chew, then also they can develop this nausea or vomiting. In sleep, the chances are very less, but still. And if they are started taking those carbonated drinks which produces gas in the stomach, they can has nausea or vomiting. And if the nausea and vomiting is persistent, or they are feeling uncomfortable, if they are having any abdominal pain, ask them to contact us immediately. Dumping syndrome is now very rare. It used to happen initially with bypass patients only, and when we used to bypass a lot. Nowadays, we don't do a lot of bypass. We do only 1.5 to 2 meters of bypass of intestine. So this is very rare. Just imagine if somebody is having this rapid pulse rate, sweating, diarrhea immediately after eating the food, that is early dumping syndrome. If it happens after 30 minutes, that is late dumping syndrome. And most of the times, the patient who is a sweet eater, they try eating sweet food. So this is the catch. If the patient is taking sweet food and they are having this symptoms of rapid pulse, sweating and diarrhea immediately, it is early dumping. 30 minutes after the meal, it is late dumping. So they are taking either sweetened food or an oily food. That is the only cause of dumping. Diet is changed, dumping will be corrected. So I told you pain in the abdomen as well as in the left shoulder area. If there is a leak, there is a pain in the left shoulder area. So just left shoulder area pain should not be ignored. And if there is persistent pain, they have to contact us. Most of the times, a patient is eating too fast or eating too much. That is why they have this pain on the middle of the chest. And after the surgery, one day it is a normal thing. After that, it improves automatically. Dehydration, if the patient is not taking enough liquids, so you have to check with them. I think you can check with the urine output. If they are passing not normal urine, the color is not yellow, that means their hydration is complete. Or if they are taking a lot of caffeine, that means it is a little bit of diuretic. Some people have a habit of taking coffee regularly. Just cut down on coffee, it will be fine. And as we know, for lactose intolerance, if somebody has diarrhea after taking the milk, That means they have lactose intolerance. They can take soya milk or lactase treated milk. Now, a lot of patients, they say we have constipation after the bariatric surgery. It is not constipation. On liquid diet, they will only pass 2 times motion in a week. That is normal. So it is temporary because they are on liquid diet. And if they persist, give them a stool softener like syrup loose, which is 10 to 15 ml before sleep. Though it has lactulose, it can be given in diabetic patients as well because it is not absorbed. On liquid diet, twice per week, stool is normal. You have to consult them, it is normal. For diarrhea, if they are having diarrhea for milk and milk products, I told you change to soya milk or lactase treated products. And also just be stop the protein shake for a day. If some people, when you start the protein, they have diarrhea, stop it for a day. Add this Econom sachet, which is a probiotic, twice daily for 3 days. Add some curd and also give ORS in 1 liter of water because it will give them energy. Otherwise, they will become weak. And once the diarrhea is complete, restart the protein. And if there is no diarrhea, then it is fine. If there is again diarrhea, we have to change the protein. If the patient is taking whey protein, give them homemade protein or give them other sources of protein. So you have to be very careful when they have diarrhea. Stop the proteins for a day. Add this sachet twice daily for 3 days. Start ORS in 1 liter of water. Don't wait. And just important thing is ask them how many times they have gone for stool. What is the consistency of stools? So then you will know better what exactly they are having. If they have passed motion only once and it is liquid on a liquid diet, it is normal because on liquid diet we don't expect semi-solid or hard stools to come. Okay. Heartburn, very important cause is taking alcohol or this carbonated drinks, or people have started using straw, which fills the stomach with air, and when they drink, they develop this heaviness or heartburn. And sometimes some people have with lemonade, which or pineapple or orange juices if they're drinking too fast, or some people are sensitive to it. Just when you know whatever is there, what the causes, you can just remove that and they will be fine. If somebody says I am bloated, that means they are again drinking too fast. Sip slowly, ask them to move around, they will be fine. Very rarely the patients have taste and sensory changes after gastric bypass. Sometimes it can be considered as a good thing because now their favorite food is not a favorite food like pizzas and burgers. You have the opportunity to change those favorite foods to new healthy foods. And rarely in sleeve or the blockage of stoma doesn't happen. But since in gastric bypass where there are two openings, like here there is one and two in RYGB, and here this is one in mini gastric bypass. If they're taking a lot of large particle size bolus without proper chewing, they can feel like some vomiting because that bolus has stuck at the anastomotic side. So I have told you, and I'm telling you again, ask them to chew properly and eat slowly. Then this problem will be sorted out. At that time, ask them not to eat for 2 to 3 hours. Slowly, the food will go down and they will feel comfortable. So this is very important. I have told you the danger signs. Rupture of staple line after 48 hours is very uncommon unless the patient is a smoker, because a smoker can cause this staple line leak anytime throughout the life. So smoking should not be there. So if there is a rupture, the patient will have abdominal pain, fever, and tachycardia and the shoulder pain. Ask them to report the surgeon to report to a surgeon immediately. Then whatever was the first presentation of by Daksha was the weight regain. So how weight regain can happen if somebody is taking large size meals again and again, because they think we used to eat 3 rotis. How can we eat half or one roti and feel comfortable? So the stomach is like a balloon; it can stretch. Though it may not become like the original size as was there before surgery, but definitely it can become in between, and the weight increase can happen. So gain or no further weight loss. I told you last time, Taraju principle. If somebody is not, as the diet is increasing, if they are not increasing the activity, the weight loss will stop. Or weight gain will happen if they are taking more high calorie foods, which they used to take before. That is why diet recall or a daily diet diary is very important, as was told in the first presentation. If they are eating wrong snacks or there is no physical activity, these are the only 2 or 3 causes for weight gain or no further weight loss. Remember, a patient after bariatric surgery is like a newborn baby. Treat them like a newborn baby. Nowadays, we also do bariatric surgery by robot. So this is our one of our patients we have done robotically, where a surgeon sits on the console and these are the arms which are doing the surgery. Like we are doing suturing here. A lot of you dietitians will be working with surgeons who are robotic surgeons. Everything is the same. It is just that the robot is controlled by a surgeon. That is the only difference. Okay. So I always give a take home message after every presentation. This is my take home message for today. Bad habits versus good habits. Make bad habits more difficult, make good habits easy. How can you do that? Suppose somebody has a habit of watching TV, and it is a TV for long hours. What you can do is put a remote at a distant site. So every time they have to open a TV, they have to lift the remote from a distant site, come back, open the TV, and once you open the TV again, put the remote at a distant site. It has to be repeated multiple times to open or close the television, and you can see that the time they are seeing the television decreases. So what is a good habit? Make good habit very easy. Like I told you about implementation intention, that you implement and write on a piece of paper that tomorrow at this time I will do this activity exactly at this place, or tomorrow I will eat this diet, and prepare for tomorrow as explained in the first presentation. Again, if you prepare your clothes, you prepare your food you have to eat tomorrow, prepare it today. Bring all the vegetables you have to prepare for tomorrow. And nowadays you can order the grocery, it will come in 5 to 10 minutes. So make the good habit easy. If you have right snacks, you will only eat right snacks. So if it is not available the healthy snacks, you will eat whatever is available. And that is how you can make good habit easy, by making healthy choices available. And make bad habits difficult, like remove all the carbonated drinks from the refrigerator, remove all the cakes, burgers, pizzas, don't keep anything at home. And once it is not there, it will be very difficult when you are feeling hungry to wait for 30 minutes for the pizza to come. In your front you are having nuts, you are having those food which is available, you will eat that. So this is how bad habit versus good habits work. Thank you very much. I think we can discuss and take the questions from you. It is nice that you people are doing well with the patients, and I hope I all of you will get some patients very soon. And you will do very well, and one day you will save somebody's life. Then this teaching will be worth. So I think we are open for questions. Anybody has any question from presentation 1, 2, or 3, they can ask.
Yes, sir, I have a question.
Yes.
Second presentation related to vegan diet.
Okay.
Like it was told that in vegan diet, most of like not all the nutrients are met. There is definitely a deficiency. Like
Okay.
having supplementation for a longer time, will it not have a side effect?
Okay. Excellent. Vrinda, you want to answer? You want me to answer?
Sir, I would like to answer.
Yes, please go ahead.
See, if they make a vegan diet as a choice, and if the important vitamins like vitamin B12 is not met through vegan diet, then I guess there is no other option but to take it for a longer period of time. And I guess vitamin B12, commonly known as B complex, it is usually taken and it is
Okay.
called considered a safe supplement.
Okay. And
So.
vitamin D, what is your opinion on vitamin D?
Vitamin D can be still, if they go have a walk in the sun, if they maintain a routine, and also maybe through fortified mushrooms or something, they can have.
Okay. So
But
now I,
if still it is deficient on the while in
okay.
during the blood test, then they'll have to take it for
So
3 months.
long-term supplementation. This is your question. So important thing is, whenever we do surgery, people who are obese, those who are eating more, when we do the testing for them, all of them are deficient for vitamin D and vitamin B12. Even if we all of you we get our tests done, I think even if we are vegetarian or a non-vegetarian, we will be deficient in vitamin D 100%. But for vitamin B12, we will be borderline or we will be deficient. Why this so? Because vitamin D, it has to be taken from sunlight, and we are not spending half an hour. It has to be 15 to 30 minutes without any clothes, then only you will be having sufficient vitamin D in the body. But that is not possible. So that is why vitamin D supplementation is recommended, like 60,000 units once in. If you are deficient, first become normal, like take the sachet or a tablet 60,000 units once a week or once 15 days for 3 months. Then your vitamin D becomes normal. Then there is a maintenance dose. You take it once a month, and this is done by all the people nowadays. Like in countries where they are live close to the beaches, they go to the beach, they do the sun bath. I think in those people maybe vitamin D may not be deficient. Vitamin B12 long term supplementation is no problem because it is a water soluble vitamin. If you take more, it will pass in the urine. So vitamin B12 supplementation is not a problem at all, and you can take it whenever, how much long you want. But vitamin D excess can be dangerous. It can cause toxicity. So very necessary that you complete your dosage and then take only a maintenance dose, which is once a month or once in 2 months. Any other question?
Sir Fatima here. So
Yes.
regarding the third and fourth phase of after bariatric surgery, do we have like calorie limits of the diet? Like you have never mentioned that how much calories should the
Okay.
patient should intake.
That is also a very important thing. So phase 3 and phase 4, what was your uh, first assignment? All of you made some charts about 1200 to 1500 calories and 80 to 90 gram of protein, right? All of you have made charts, right?
Yes, sir.
That is what you will be required, what you
Sir.
will be requiring in phase 3 and phase 4. So you were preparing yourself for a phase 3 and phase 4 diet automatically. See, what happens is the daily calorie requirement is 1800 to 3000 calories, depending how much activity you do. If you are a sedentary worker, if there is a female who stays at home, who doesn't do much of household work, who have a lot of maids inside the house, their energy requirement is only 1500 to 1800 calories. For a male who is going outside, who is working hard, who is in some strenuous job like lifting some luggage or doing some strenuous activity, they require 2500 calories to 3000 calories. If somebody is an athlete who is doing a lot of activity or who goes to the gym, they are basically utilizing 2500 to 3000 calories. Protein requirement is 1 gram per kg. So if you are 150 kg, 150 grams protein, you won't be able to take whatever you may try. So ideally, a patient who has already reduced weight and now has become for 150 to 110, 120, at that time you can give them at least 80 to 90 grams of protein and 1200 to 1500 calories to keep them in a negative energy balance according to the Tarazu principle, and they will keep on losing weight. At that time, if their energy requirement is increased, they have started eating a lot of high energy drinks like 2000 to 2500 calories, and they have not increased their activity, their weight loss will stop, or they may start gaining weight as well. That is why at that time protein is very important, because that will reduce the total calorie intake. Very important is, if you want to basically balance your muscle mass, which is more the muscle mass, more will be the metabolism, as explained in the first presentation as well. If you have high muscle mass, your metabolism will be high. Those who have low metabolism, most of the times their muscle mass is less, because muscles use a lot of energy. So if even if they have 120, 130 kg of weight, they may be having very less muscle. That is why their metabolism is slow. To increase the muscle mass, the protein intake has to be 1.5 to 2 grams per kg of body weight. So a lot of the people who go to gym, or a lot of people who want to build their muscle mass, they take 1.5 grams per kg of body weight, so that the muscle mass increases, and so their metabolism will increase, and their weight, if they are overweight, their weight will decrease. If they are not overweight, they will start building their muscles, right?
Yes, sir.
Any other question? Yes, any other question?
So regarding the recipe you shared for the home-based protein shake, when we
Okay.
usually give whey protein, it is only the whey protein. The carbs and fat is not included. But in homemade protein, the carbs is also there.
Yes, yes, you're right.
So
Actually,
we need to,
yes, the idea
yes, sir.
is initially when on clear liquid diet, we want everything to be purely liquid. That time in 100 ml of water, you can use 25 grams of one sachet of whey protein is 25 grams of protein. So they will be adequate in phase one and phase two. But in phase three and four, obviously you will be needing a more of a balanced diet. At that time, I think after 15 days or 1 month after the bariatric surgery, according to the patient, you start this homemade protein because it has all the healthy nutrients. There is nothing because nowadays it is coming in the newspaper as well that how much whey protein we don't know. What are the preservatives we don't know. Is it actually giving 25 grams of protein we don't know. But this will definitely give you between 20 to 30 grams of protein definitely. So my choice is this. For last 3 months, I am taking this protein every day, and I am enjoying it. The taste is good. You get a lot of this multivitamins also. Other like we have cashew nuts, raisins, almonds, all are there. So you get omega 3 fatty acids as well. So I think this is a very good protein source. And whatever we are using is a jaggery. So jaggery is also a natural sweetener. We are not using sugar, and we are using chana powder, again a high protein content. So I think this is a very good recipe. We are using banana has also some very important vitamins and minerals. We are using milk as well, it has calcium. So it is, I think it is having everything. And the day I'm using this, because when I used to take whey protein, I have taken whey protein for 2 years, and the day I did not take whey protein, I used to feel weak. But if I miss this homemade protein for a day, I don't feel weak. This is my personal experience. See, whatever I tell the patients, I experience on myself as well. So when I will give you the exercise for patients in module 8, those exercises I regularly perform, and I have seen the results myself. That is why I vouch for them. So this homemade protein is, I think, is brilliant. If you have any other recipe for homemade protein, that is fine, you can share with us, we can adopt that as well. I am not saying this is the only one in the whole world, but I am using it. I am very happy with it. If you have any other recipe, just let us know and we can start using it as well. But in phase one and phase two diets, uh, we want only clear liquid protein. There, I think whey protein is better as compared to other proteins in the market. Recently, we have bought this strawberry flavor, pista kulfi flavor as well. We are trying it. We have given to a patient and she's liking it. So it's not fixed. Everybody's different. You can just see what your patient likes. Yes, any other question?
There's no question, but I really want to add something here. जब इन्होंने बोला ना कि whey versus this particular shake, so when you look closely ना, actually calories don't matter too much. अगर आप wholesome meals ले रहे हो, home cooked meals, तो अगर थोड़ा सा calories ज़्यादा भी है, तो it gets digested very easily. So it is actually better that you go for homemade, these shakes.
Okay, nice. Any other question from you?
So what is the relation of tobacco causing the breakout of the stapler lines?
Okay, very good. So just before I answer your question, all of you have signed the partnership agreement with us, or some people are left? See, we can only start giving you patients when you once you sign the partnership agreement. So those who have signed, I think we can help them and start learn practically. And those who have not signed, just think about it. I will not force you, but that will be a very good learning. So how tobacco basically affects the staple line. See, I'm not saying tobacco. I will say tobacco and nicotine. Smoking has more of a nicotine. It has been well documented that nicotine decreases the healing of the wound. It causes ulceration in the stomach. And suppose this is a staple line, and they are eating, they are smoking, or they are eating those tobacco things. So if there is an ulcer here, there are chances it can perforate. So already a staple line is there, it can perforate, and then there is a leakage. So it is not only happens in the patients who have undergone surgery. During my training, like 2003 to 2008, when I was MS, doing my MS and doing my senior residency, every November and December, we used to see a flurry of patients with duodenal perforation or gastric perforations. Those were the patients who were not having any surgery done before, and the most common thing in them were smoking or tobacco chewing, and secondly, alcohol. So what happens with it? A lot of acidity is formed in the stomach, and that causes ulceration. And with H. pylori or bacterial infection, that causes perforation. So even if a person has not undergone surgery, and if they are a continuous tobacco or a nicotine chewer, all the cancers in the world, the common factor is smoking, because it causes the irritation of the mucosa, and the mucosa, when it gets irritated, it basically can multiply, and some of them is uncontrolled, which becomes a tumor. So when there is a bladder tumor, there is a esophageal tumor, there is a CA stomach, there is a CA lung. The most common One of the most common causes is nicotine as well as tobacco. So next slide, I will show you, next presentation, what exactly a nicotine has. All the constituents of a cigarette. I will show you on my next presentation, when on the next Monday, that what exactly it has, methane gas and all the gases which are there in the toilet. It's if you basically read it, you will never smoke in your life. Anything else? And for all of your information, I have never smoked in my life, and I don't like people who smoke around me, because the smell causes me nausea. If there is any one single benefit of alcohol or smoking, I think I will be happy to start. So anybody who has one benefit of alcohol or smoking, when all days you read in the newspaper, under the influence of alcohol, a kid has killed two people. Under the influence of alcohol, that happened. Under the influence of alcohol, that happened. And then some people will say, sir, it depends on controlled and uncontrolled. For alcohol, there is no control and uncontrolled. It basically removes your inhibitions, and then anything can happen. So I honestly, I don't believe in alcohol and smoking completely, and it's individual choice. But I think it has zero benefit, and all the harms in the world can happen with alcohol and smoking. No stress will be relieved after smoking. The smoking will only destroy your nerves and make you permanently dependent on it. That is why they are known as addictions. Make a healthy addictions like reading a book, going to a gym, going to swimming classes. They are healthy addictions. Don't go for unhealthy addictions. That is my advice. It is your decision to follow or not. Anything else?
Yes, sir.
Yes, please.
So, sir, high protein food like protein shake sometimes might not suit people. Like as you said, it might cause diarrhea. So,
Yes.
what if there is prolonged diarrhea? Whether we can give protein shakes or not? Just
Okay. So if there is a diarrhea, you have to do these three things. Stop protein shakes. Give them a probiotic first. See, they may be detoxifying. So give them a
okay,
Econom sachet, which is a probiotic. I use it regularly, twice a day for 3 days. By the time they will find, or give them curd, which is a natural probiotic. Start immediately ORS in 1 liter of water, because it has potassium. Otherwise, the patient will have cramps in the legs and they will become bedridden. They will start blaming you or surgery or
okay,
whatever diet you have given. And once it is over, then you can restart protein. And if still the patient has diarrhea, that means that protein is not suiting them. Go for a homemade protein. That is also not suiting them. Go for a different protein, or go for the natural sources like soya bean, and all those things you can start. So it
okay, okay,
patient
sir.
to patient is different. So you
Okay,
can just see what suits a patient according to their physique, and then you can plan accordingly.
okay, thank you.
But always start this ORS and this probiotic immediately. Stop the protein shake. Sometimes in first week we are giving them antibiotics after surgery, which can also cause diarrhea. So once you stop all these and still they have diarrhea, that means it is antibiotic related. So we will remove the antibiotic. After 1 week, they will be not on antibiotics, and then there will be no diarrhea. And if that time we think it is because of protein, we may not give them protein at all after that, which is wrong. And patient will also think that it is because of protein, they will start fearing protein. So that time, the first week after surgery, it can be because of antibiotic, it can be because of protein. So you should wait for uh, uh, 2 to 3 days. Once the antibiotic is finished, start the protein again. If no diarrhea, that means it was because of antibiotic. Again diarrhea, change the protein. Still diarrhea, change the different source of protein. It should be fine. And one thing I want to tell you, that a lot of people think that vegetarian protein is deficient and animal protein is not deficient. It is complete. It is not completely true. If you go for 100 grams, that slide also I will show you next time. If you measure 100 grams of chicken, 100 grams of uh, meat and all those things, the highest protein content is in soya bean. 100 grams of soya bean is 52 grams of protein, which is the highest, and it is a plant source. So this is all
Okay, sir.
because the media, because it is owned by the companies of like KFC and this, all those companies. They always promote that
Yes, yes.
plant-based protein is deficient. It is wrong. Plant-based protein. I personally take a lot of soya bean. I am a vegetarian and I am not protein deficient. I can only tell you about myself. I
Okay, sir.
cannot tell
Okay.
you about other people. So I honestly enjoyed your presentation, Brenda, because it was very nice. That nuts, I always, whatever you were telling, I my diet is like that only. I take nuts and cashew nuts and all almonds in the morning. Then I take one protein, animal protein source. It's plant-based protein source. Though I take milk, that is I have not
Yes.
avoided, but rest of them is completely pure vegetarian. So soya bean has the highest percentage of protein as compared to animal proteins. Yes, any other question?
Okay.
So who is going to do the next time? Some there were some people who wanted to do next time. Anyone who is planning to present next time? So once people who have not signed their partnership agreements, they can do that. But if you are not interested, that is also fine. And anybody volunteering for next time? Last time we had 4 people, so 2 of them had done this time. Yes. Who wants to do it next time?
Yes, sir, it was me,
Yes. So
Tejasvi.
what is your topic?
I'm doing I'm doing on a dash diet.
Okay, dash diet. And Yusra, you want to present?
I know
Okay.
the topics first.
And who else? Second one. I think Mai was wanted to present. She's not here this time. No issues. So I wish you all the best and enjoy serving people, helping people, because that will release serotonin in your body, which is a happy hormone. Okay.